very gently breaking up those lip lines. And this takes a couple of days to really settle in, but you're going to see, oh, our headband just moved. You'll see how effective it is. When I'm doing filler, I like to have the patient have a headband. I like their hair to be totally off their face. Sometimes the headband slides back. We have these, the ones that slide the least are the cotton ones. These are kind of stretchy and they move. So they're not my favorites, but that's what we had today. There we go. Again, there I am. My cannula, you see what's happening? So I go back and forth. I inject as I'm moving my cannula out, not injecting here, pulling back here, not injecting, injecting. And then I'm going to finish it off with the tiniest little needle, super tiny. I use a 34 gauge needle coming up. Watch this. I have a little bit left in my syringe. I take a 34 gauge needle. Don't worry about the lump. I'm going to massage it. They're called an invisible needle. They're a little costly, but they're so fantastic. And then instead of injecting toxin into each line, this is a combo of Belotero and toxin. And I just pick off these little tiny lines very superficially with my 34 gauge needle. And it's so great. This is a technique I urge you to learn, and learn quickly because it'll be something that your patients enjoy a lot. I come from the side, very superficially, tent the skin up. See, you can almost see the tip of my needle. Oh, Pat's, you can see yourself. You can watch this. I didn't realize that. I wasn't thinking about it. You okay?
Yeah.
Some patients don't like to watch themselves being injected. Yeah. I'm ready for questions at any moment. You just tell me, you name it. Look how nice that looks already. I get so excited. Let's see. Wait,